So this video is going to be about how to use the anchoring of the core or the abdominal muscles to then lift the chest and to create a little more arch, more subtle arch for the neck. So a lot of tightness, stiffness, pain in the neck, especially if you've been sitting for long periods of time or even at night sleeping and waking up in the morning with tight stiffness or locked neck. That can be the result of postural collapse, which becomes more of a all the time kind of thing, like permanent. So we want to think about, if I'm kind of more sideways here, what is the contour of my spine? So right now I'm slouched, and you can see that it's more of a big hump in my upper back there. So what that means is that I'm going to compensate by hinging way up here in my neck, which is going to create a lot of tightness as I overwork those muscles up there. And I'm underutilizing my core to anchor because I'm just collapsing into an anchored position. What I'm not doing is lifting my chest. And when I do that, I want to be careful, because if I'm lifting my chest and not anchoring through my core, now I'm going to arch my back and create tightness and maybe pain in my low back. So I want to anchor from those ribs back here, which pulls my rib cage down, simultaneously lifting the chest and then creating a more gradual arch for my neck as I stretch tall. That also includes the shoulder blades coming back, and that's where you're going to feel a lot of tightness in those pectoral muscles, and you're going to have to feel probably some work being done by your abdominals as you do this, and try to work that. Now I can use some assistance, and they do make devices. I can't think of the name of them offhand or any particular brands, but it's basically like, it looks like a little bridge, it's plastic, and you basically lie down with your head back over it. Now you can use, this is a pretty like squishy, it's like a deflated kid's ball from the Big Ben's in the stores kind of thing, really soft though, rubber. You can use a beach towel and roll it up tightly so it's kind of has some give to it. You can use things that are firm, but they just need to be comfortable and not, too painful, especially if it's not quite the right size. You want to make sure it's not, making things painful or irritated. So this has some give, so I'm going to put it back there. I'm going to put it right under my neck, and I'm going to kind of nestle in there. So that way, when I anchor my ribs and lift my upper chest here, I want to feel that tension. I don't want to lose those ribs. Keep my hips there too, and I got my knees bent to help offload my back. I want to feel like I'm kind of gently curving over this here, and I've got the pillows there just so I can like rest the back of my head and I don't feel like it's just hanging. But I want to feel that kind of get that curve a little bit. Now I can progress this with maybe some weights or just my arms, and try to keep that as I bring those arms up and then back down, maybe one at a time. And then you can see my left side's a little tighter there today, so I'm gonna like work out the tightness, but training myself to preserve the subtle curve of the spine in the cervical spine, as well as straightening out a little bit, not excessively, but the thoracic, and then and just maybe a subtle curve in my low back as well. Although it's okay when you're laying flat on your back, it's a little flatter there because that won't stay that way when you're upright. But just trying to train that, work that, maybe work into some rotation. If I can maintain that spine here, and then maybe spending a few minutes every day or before you sleep, especially if that's when you get a lot of tightness and stiffness there, laying like that and maybe doing some exercises like that to loosen that up and kind of get things ready and more used to and retrained for when you sleep, when you have the least amount of control over those things. So hopefully that helps.